If you want a Medicare supplement plan, the two most popular plans are the Plan G and the Plan N. Now, typically of those two, the Plan N is the least expensive, but the question is, can you stomach the downsides? In this video, I'm going to break them down and show you which plan wins in each of the categories so that you can decide which one you think is best for you. Okay, the first difference is the overall coverage. Which plan provides better coverage? Well, there are 6 gaps in original Medicare that you're responsible for paying out of pocket, and both the Plan G and the Plan N provide different levels of coverage for these. So let's start with the Plan N. As you can see in this chart, Plan N will pay for the Part A deductible, which is set to be $1,676 per benefit period in 2025. That's $1,676. Everyone who's on Medicare has to pay this, so it's nice that it protects you from that cost. So if you need to stay in the hospital for a few days, Medicare Part A covers your hospital stay, and you normally have to pay some daily cost out of pocket if you didn't have a Medicare supplement. A Plan N helps cover those costs, so you're not stuck with a big bill. And it'll also do this with skilled nursing facilities. The Medicare Supplement Plan N will cover 20% coinsurance that you're responsible for paying. So let's say that you go to the doctor and your bill is $200. Well, Medicare pays $160 of that, and your Plan N will typically cover the last $40. But wait, when it comes to the doctor, you will have to pay a copay of $20 for every doctor's visit and $50 anytime that you visit the emergency room, as long as you're not admitted to the hospital. Also, Plan N does not cover Medicare Part B deductibles, which are $257 in 2025, so you'll have to cover that yourself. And it doesn't cover Part B excess charges. So if you don't know what these are, Part B excess charges, they happen when a doctor charges you 15% more than the Medicare approved amount, and you have to pay that 15%. So I'll talk about that a little bit more later in the video, but it's just important to know that they are there. They tend to be pretty rare, but still 2% of the time doctors do charge excess charges, so if you happen to hit that 2%, it can be expensive. So that looks at the overall coverage for Plan N. Now let's compare that to the overall coverage for Plan G. As you can instantly tell, Plan G covers more than the Plan N. The Plan G takes your Part A deductible, your hospital copays, and it also takes care of your skilled nursing facility copays. It covers your Part B 20% coinsurance, and it doesn't have copays like the Plan N has, and it completely protects you from Part B excess charges, so you will never get hit with a surprise bill. Now really the only thing that Plan G doesn't cover is the Part B deductible, and once a year, if you're on a Plan G, you have to pay that $257 Part B deductible. You're essentially paying this at the beginning of the year, and then you're done paying out-of-pocket costs for the rest of the year. And that's why when it comes to the overall coverage, it's very clear which plan is going to get this point. That's right, this point goes straight to the Plan G because it has the best overall coverage compared to all of the other Medicare supplement plans. The next difference we're going to go over is the initial premiums, which I'm talking about when I say initial premiums, the amount that you're going to pay out of pocket when you first enroll in the plan, when you're first eligible for Medicare. So remember that word initial because we're going to come back to that later. When it comes to the Plan N versus the Plan G, you'll always find that the Plan N costs less across the board. Here's a chart showing prices that I could find in some states. As you can see, the cheapest Plan N I could find in Houston, for example, costs $31 less than the cheapest Plan G that I find in the same area. Now in Miami, the difference between the lowest Plan G is about $50 more than the lowest Plan N. That's why even though there's no standardized pricing for Medicare supplement plans, Plan N almost always has a lower initial premium than a Plan G. So obviously here in category number 2, we're going to give the point to Plan N for being the most cost effective on a monthly basis. So if your goal is to lower your initial premiums, then Plan N will most likely give that to you. The third difference that I want to take a closer look at is premium rate increases, because where you start is not necessarily where you're going to end. Remember that when I said that the initial premium, that word initial was important? Well, here's why. One mistake that I see a lot of people make is that when it comes to Medicare supplement plans, they only look at that initial premium. How much am I going to pay when I join the plan? But unfortunately, they could see an increase. Well, they will see an increase over years in their plan. And you should be aware that these plans become a lot more expensive as years go by. Now, if we look at the historical data, you'll see that Plan G tends to get higher rate increases across the board than Plan N. That's kind of interesting. So let's take a look at this actuarial study done by Telos Actuarial. As you can see, based on this study, the company one's Plan G premiums increased around 5% in 2020, 21, 22, and then jumped to 9% increases in 23 and 11% increases in 24. However, company one's Plan N increases were much lower, 2% in 2020, 4% in 2021, back to 2% in 2022. Now in 2023, it jumped to 6%, and it went up to 10% in 2024, but that's still lower than what Plan G did. And keep in mind that these are real companies. I know that we've said, company one, company two, etc. But these are real companies and real rate increases. I just changed the names to generic ones so that I wouldn't get myself in any trouble here. But as you can see, the Plan G tends to have higher rate increases than the Plan N. So why would that be? Why would Plan G have bigger rate increases? Well, I'm going to tell you 3 reasons why a Plan G may have larger increases than a Plan N. The first one is called adverse selection. Adverse selection means that the plan with the best benefit is probably going to be selected by the people with the most health needs. That's adverse. It's adverse to the plan, not adverse to the person with the health needs. But adverse selection says the very best plan is going to have the sickest people because it's going to attract them. The second reason is that with a Plan G, it's covering your excess charges. And so that means that there can be some variation in cost. And then finally, the third reason I would share with you, and there could be other reasons too, but the Plan G has guaranteed issue rights for certain people. So for example, let's say that you lose your Medicare Advantage plan. Well, that gives you the opportunity to sign up for a Medicare Supplement plan, no questions asked. And if that's happening, then you may be in difficult health conditions. You may be seeking cancer treatments, or maybe you need to be hospitalized, or you have big surgeries coming up, and you say, I have this right now to get on a Medicare Supplement plan, no questions asked, and it will cover my treatment 100%. But the guaranteed issue rights are not available for a Plan N. You can't join a Plan N because you're losing your Medicare Advantage plan. You can't join a Plan N because you've moved out of the service area of your Medicare Advantage plan. The guaranteed issue rights are only for a Plan G. And so that's why in this category, the point is definitely going straight to the Plan N. Not only does the Plan N have lower initial premiums, but it has lower rate increases over time when you're on this kind of plan. All right, the fourth difference we're going to look at is what I would call unexpected costs or surprises. Now, one of the strongest arguments for a Medicare Supplement Plan G is that it almost has no surprises when it comes to your health care. There are no variable costs that are going to pop out when you have a Plan G, with the exception of your prescription costs. Remember, we're only talking about your health costs here. Your prescription drug costs are on a separate plan when you're on a Medicare Supplement. But when we're comparing Plan G and Plan N, Plan G doesn't have surprises. You don't have co-pays and co-insurance. You just have one deductible every year, $257 for your Part B. That's it. So that makes it very easy to calculate what your costs are going to be on a Plan G. You are going to pay your premium, you are going to pay a $257 deductible, and after that, everything's covered. Now, with a Plan N, it's a little different. Of course, you're going to have your premium, and your premium for Plan N is going to be lower than your Plan G premium, so you have some savings there in the premium. But you can have some unexpected costs. So if you're looking for peace of mind, go with the Plan G, no unexpected costs. Because on the flip side, the Plan N, you have to estimate how many times you're going to go to the doctor, how many times you may visit the emergency room, if or if not you're going to see a doctor that charges excess charges. Because remember, with the Plan N, when you visit a doctor, you pay $20. When you go to an emergency room, you pay $50. So these costs in a Plan N can potentially wipe out any savings that you had in premiums. And finally, you also have to be aware of the Part B excess charges, which can pop up when a doctor charges that 15% more than Medicare. Remember, with the Plan N, you'll have to pay excess charges 100% out of pocket. They're yours to pay. Your Plan N's not going to help you. Now, Part B excess charges are rare, about 2% of the time. 2% of doctors, I shouldn't say percent of the time, 2% of doctors can charge excess charges, but the vast majority of doctors accept the Medicare approved amount. But it's a variable cost, and it can be very expensive if you're hit with one. So for example, if a Medicare procedure costs $1,000, then you will have to pay 15% more than that. The doctor could charge $1,150, and you have to pay that $150 out of pocket. And just like that, your premium savings for your Plan N were wiped out. And imagine if it's a more expensive procedure. If it's a $10,000 procedure, that's $1,500 that you have to pay out of pocket. Now, you could potentially avoid excess charges by always asking your doctor before you get treatment. But remember, that's not always possible. Sometimes you're getting treatment in an emergency. Sometimes you don't have control of the situation, or you are worried about other things other than how is this going to be billed. I actually know of a situation with one of my clients that it was the anesthesiologist that charged the excess charges. It wasn't even the doctor performing the surgery. So there was really no way for the patient to ask beforehand. I mean, it was an emergency situation. They're going into surgery. They're probably not even aware enough to ask, hey, does the anesthesiologist charge excess charges? And that's why when it comes to surprises, Plan G easily gets this point because Plan G is very steady. And if you want peace of mind, then Plan G is definitely the stronger plan for this. Now, before I go to the last difference here, let me just jump in and say that if you're finding this interesting and that it's helpful in some way, please hit the like button because that helps our channel and it helps this video also reach other people who have questions about Plan N and Plan G and other Medicare things. Also, please consider subscribing. We make a lot of helpful video content like this about Medicare. The next difference we're going to go over is about agents. Now you might be thinking, what do agents have to do with choosing a Plan G and a Plan N? You see, regardless of the plan type of Medicare that you get, you're almost always going to have an agent. This doesn't cost you anything, and so there's no reason to not have an agent. However, there are also some greedy agents out there who try to push you towards one plan type that pays them more commissions, and oftentimes that's when they put their best interest in front of yours and they're not recommending the plan that's the best fit for you. For transparency's sake, I'll tell you right now that a Plan G is going to pay more commissions in most cases than a Plan N. That's right, Plan G pays a higher commission to agents than Plan N in most cases. This is because most Medicare Supplement plans are paying commissions based on a percentage of your premium. And since the Plan G costs more, that means the premium is higher. That means that if an agent persuades you into signing up for a Plan G, that agent will get a higher commission than if you signed up for a Plan N. Also, Plan G is a lot easier to explain than a Plan N. You just pay premium, Part B deductible, and that's it. So if there's an agent that's selling a Plan N, they have to explain the difference to their clients. They have to explain about copays. They have to talk about Part B excess charges. And so some greedy agents will try to push everyone into a Plan G, even if it's not a right fit for them. Instead, a good agent should help you understand both of these options. Helping you enroll in a Plan G is good when it's actually the right thing for you and it fits you best. But it's wrong when an agent is forcing it onto you without explaining the drawbacks of the plan. But back to our topic. This category has to do more with agents than it has to do with the plan. And that's why I'm saying that the difference still is a tie. It's not that there's a difference between the plan types, but you need to be aware and make sure that you have an agent who's unbiased and is not steering you towards one option or the other. Now, I'm sure that you're probably looking at this with disappointment saying, are you kidding me? You could have just told me in the beginning it's a tie. Well, hopefully you've learned something in watching this. The better plan really depends on you and what is best for you. It's not that a G is better or that an N is better. It's that we need to figure out what fits you best. So as you can see in the chart, people who want peace of mind, they don't want to have surprises, they want to have the most coverage. Well, for them, it's a Plan G. While people who want to maximize their saving and want to have lower premiums or lower rate increases, and they're okay with a few risks that come with the Plan N, like copays and potentially an excess charge, then they gravitate to the Plan N. And we can also see either way that choosing the right insurance company and having the right insurance agent is also a big part of whether or not you're in the right plan. So go ahead and contact us at the number on your screen if you need help. And if you want to learn more about both the Plan G and the Plan N, then check out my brutally honest reviews of both of these plans here on the channel. But other than that, thank you for watching, and I'll see you next time. Bye-bye.